Welcome to the WCPO Insider Report from the 9 on Your Side I-Team. A story this week from former health commissioners who are now accusing the man who runs the Center for Closing the Health Gap of costing the city about $500,000 in state funding. 3 former Cincinnati Health Board members tell the I-Team that Dwight Tillery lobbied Cincinnati City Council in 2008 not to establish a state-funded minority health office in the city, and that allowed the Health Gap to take the lead on minority health issues over the past decade. That's Tillery's organization, and collect almost $4 million from the city. The city launched an audit last month into the nonprofit after an I-Team investigation. WCPO.com reporter Paula Christian's been working on this story, and you're a part of this investigation. So let's go back to the beginning, back to 2008. Exactly what happened?
Well, the state came up with a pot of money that they were offering to the biggest urban centers to establish minority health offices. So they invited big cities, 7 big cities, including Cincinnati, to apply for this grant. And it was a $250,000 grant to get this office started that would directly look at improving minority health. So of course the health department in Cincinnati applied for the grant. They received the grant. We contacted 3 former board members at the time who were dismayed that they were forced to give the money back.
And forced, they say, by Dwight Tillery at the time.
They were contacted by Dwight Tillery, who urged them not to vote for this grant because he felt that it would be a duplication of services from what his nonprofit was already doing. They felt like, why can't we all work together, use this new money, complement what you're doing, and really tackle some of the factors that are leading to minority health issues in the city.
And you pointed out that Cincinnati is the only major city in the state of Ohio that doesn't have this.
It is. It's really unbelievable that Columbus, Cleveland, Akron, Youngstown, all these cities have these offices within their health departments without Cincinnati, not Cincinnati. And the money at this point is gone. The state is not offering it anymore, and the city cannot recoup the, to date, roughly $560,000 it would have received from the state to do things like have a visiting nurse, visit zip codes with very high minority health problems, or a mobile clinic. Those are the things they wanted to do that they can't.
And that's the point of all this. It's about money, certainly, but it's about losing health care to people who needed it over the last 6 years at least.
Absolutely. And now the Center for Closing the Health Gap is a nonprofit that's primarily been funded in recent years by the city. It received $1 million last fiscal year and is asking for $750,000 this year. That's city money. And the city is facing a $25 million projected deficit this year. So I don't know what kinds of funds the city is going to be able to offer for minority health.
It's a big problem, and you can read the I-Team story, Paula Christian's article, right now on WCPO.com to learn more. Paula, thank you.
Thank you.